My name is Lucretia Butler. I'm a director in IS System Applications at Community Health Choice. We have over about 400,000 members. The lines of business that we do is Medicaid, which is STAR and CHIP Parinate. We also do healthcare exchange along with DSNP program and STAR+. So my history with Cognizant goes back to even from my previous employer. So I've had a relationship with Cognizant since about 2008. And so when I came to Community, that was a good thing because I already had this relationship established. The STAR+ program, it's a very complex program and it's mostly for the adults, but it's mostly adults that's on disability. You have to handle that population with care. Based on the complexity of it and the regulatory requirements, we were looking for how to make QNXT work for us with the STAR+ program. Outside of using the core system QNXT, we also utilize the HPA robot to process some of the processing of the nursing facility claims in STAR+ requires a manual process in a sense. You have to look at the member's applied income, you have to look at the RUG level, and so it's not just your normal daily claims processing. We also use like claims workflow. We utilize NetworX Pricer was amazing because their fee schedules for LTSS requires you to price the claim up to 4 modifiers. And so NetworX really came through with allowing us that capability to do that. So the implementation process was very stressful, need I say, because there's a lot of regulatory requirements and you had to meet with the state and talk to them about all the details of STAR+. And so as we were doing that, I realized El Paso and Community First is going through the same madness we're going through. So why don't we just join forces and talk about what you're doing compared to what we're doing? And it was really a lot of good collaboration. All 3 of us are on the Q user board. By being on that Q user board and just being a part of the Q user community, it helped us understand as reaching out to other plans. And so the biggest thing about that was being on the Q user board because I would have never had that connection had that not existed. And so when we realized the level of stuff that we had prepared for, we knew then at that point that we collaborating would be a better way for us to get on the same page. And actually, the state of Texas actually told us that the 3 plans in Texas were just hit it out of the ballpark. I think by utilizing the tools within that Cognizant had for us, it allowed us to have a better implementation, a more easier readiness review. The majority of our claims that are processed for nursing facilities are done by the HPA robot. Well, how we overcame a lot of things was related to some of the tools, talking about the tools that Cognizant has, like NetworX Pricer, understanding the LTSS services, because the LTSS services is very complex. And so utilizing that tool and being able to communicate and collaborate with the other plans, El Paso and Community First, we were able to understand exactly how we could configure the system, how we could configure our benefits for the members with the different RUG levels. And so it was a lot of collaboration in regards to how you're utilizing the system and how we're utilizing the system. And we didn't all do it the exact same way, but we all came up with the same result of hitting out of the ballpark with our readiness review. I feel like my relationship with Cognizant is really a good relationship. I've grown with them. A lot of times you don't realize the effectiveness of your input with Cognizant until you have those one-on-one conversations with them.